So my name is Sarah Zadunik, and I'm a public health project coordinator at the National Indian Health Board. Carrie Joseph has also joined us. She's works with me on this project, and she's deputy director of the Public Health Policy and Programs Department. So just an overview of what we're going to talk about today. I'm just going to walk through the funding announcement, what a complete application would look like, how to create your work plan and write what we call SMART objectives, and then we'll go into any questions that people may have. So just an introduction for those who are unfamiliar with the National Indian Health Board. We're a 501c3 nonprofit whose purpose is to advocate on behalf of all federally recognized American Indian Alaska Native tribes to ensure the fulfillment of the trust responsibility to deliver health and public health services as assured through treaties and reaffirmed in legislation, executive orders, and Supreme Court cases. Our mission statement is one voice, affirming and empowering American Indian and Alaska Native peoples to protect and improve health and reduce disparities. So just to jump right in, the funding announcement, what is it for? It's for tribes or tribal organizations that are currently or want to address Alzheimer's disease and other dementia in their communities. It will use the roadmap for Indian country strategies is a requirement, as well as partnering with another tribal or IHS program. And I'll talk about both of these components in a bit. So the funding is about $15,000 each, and we're going to fund up to 12 proposals. The project period will last about 11 months, so from September 1st to July 31st next year. The completed application is due Friday, August 13th at the end of the day, Pacific time for those not on Eastern time, of course. And all applicants will be notified of their status. So even if you do not receive funding, we'll still let you know by Monday, August 30th. So just a brief, quick overview of the roadmap to Indian country strategies. I put a link to our website. You can view the whole roadmap to Indian country and read through all the strategies there. Just a quick description of what it is. A public health approach to addressing Alzheimer's disease in Indian country, developed by the Alzheimer's Association with the CDC as a part of CDC's Healthy Brain Initiative. So in the roadmap, it discusses 8 strategies that we're asking applicants to implement in their work plan for the funding. So I'm not going to read through all of them. You can look at them again online. Just a quick little description. They're separated into 3 categories. First being educating and empowering community members. So the first set would just involve that. And then collecting and using data and strengthening the workforce. So like I said, we're expecting applicants to partner with another program or entity. It can be a tribal program or an IHS program. This is important to a public health approach. Strong partnerships are very important to this type of approach. And then in the application, we are going to ask you to provide a description of who you're partnering with and why it will help you reach your goals and objectives. So who is eligible for this funding opportunity? Federally recognized tribal government, tribal organization, or intertribal consortium as defined in the Indian Self-Determination and Education Assistance Act. So this is not intended for urban Indian health organizations. And if you are currently receiving NIHB funding, you can still apply and possibly receive this award. So what does a complete application package look like? It'll first be a completed application form. This is, again, you can download on our website, but it's just the demographics, who are you, who is your point of contact, things like that. A completed work plan with assigned funding amounts, and I'll also go into this a little bit later, the assigned funding, similar to a budget. You'll also need a copy of schedule findings from your most recent audit, a letter of support from the partnering tribal program or entity that you're choosing to partner with for this funding, and then also a signed letter of support from a tribal official. So you need all these components to be considered for the award. Incomplete applications will not be accepted. So when writing a work plan, you of course need your objectives, and we ask you to follow the SMART objective guideline. It's just sort of a mnemonic to remember what makes a strong objective. So just to walk through that, the S is for specific. So objectives should be specific, providing who and what is leading the program activities. Should be measurable, meaning focus on how much change expect to have. Should be achievable, so can you actually do this within the time frame you have and the resources and the funding that you have. Need to be realistic, meaning relating to the overall goal of the project. And then time phase, which is what is the time frame for completing this objective. So an example of this could be by April 2022, the Tribal Public Health Department will host 5 educational meetings in the community about the signs of dementia. So it has a timeline, has who's performing the activity, specifically how many 5 educational meetings, and it relates, of course, to the overall project, which would be addressing Alzheimer's disease and dementia in your community. So moving to the work plan table. So as you can see at the top there, your objective would go in the first box. And above that, we do want you to list the strategy that you're choosing to address and that the objective is related to. And we added on the right-hand side a column for assigned funding. And this is just to show how much funding you plan to allocate to each activity. And you don't have to allocate funds to every activity, but we are asking you to put this here, and it will replace the budget. You won't have to attach a formal budget along with this. The assigned funding is sufficient. Just more about that. The funding, just a list of what cannot be used for. You can see here, but common things to note is food or beverages, providing direct support to external individuals, purchasing large equipment, lobbying, things like that. And then due to the size of the award, because it's $15,000, the funds cannot support indirect costs. So that is the conclusion of the pre-application webinar. Remember that applications are due Friday, August 13th. You can access the funding announcement and download the application at our website, nihb.org/brainhealth/funding, which you can put in the chat box in a bit. And then we'll submit full application packages via email to me at my email there. And you can, of course, email me questions, or if you're having trouble accessing the application or it's not downloading, something like that, I can send you a copy via email. So now, if anyone has any questions, you can raise your hand and I can unmute you, or you can just type in the chat box.
Sarah, I have something to add, if that's okay.
Yeah, go ahead.
Just going back, can you scroll back to the roadmap strategies?
Yes.
Slide of 8.
Oops.
And I just want to stress that in the application and your work plan, you choose which strategies you're going to focus on. You don't have to choose 8. You don't have, 8 would be too many for this amount of funding. So just be realistic in what you choose. 1 is fine. Choosing more isn't going to put you at a higher advantage for this funding opportunity. It's really what makes sense for you and your community. But just knowing that it's you don't have to have all 8. 1 is fine, 2 is fine. If I was, writing, I think 2 might be plenty. It just sort of depends on what other resources you may have as well. But just whatever makes sense in your community, what your community is ready to do, you and your partners.
Yeah, thank you, Carrie. And there's not any sort of preference given to applicants who can do more than 1. It's not based on that. And then I see there was a question in the Q&A, and I'll just read it out loud for everyone to see. Tawny Booth asked, partnering with other tribal entities, can it be within your own tribe or other tribal community? Yes, both are fine.
It's also fine to have multiple partners. We only ask that you list 1. But if you have other partners, tribal partners, or even non-tribal partners outside of your one tribal or IHS partner, that's fine as well. And please describe that, but it's not required. Just 1.
And then in the chat box, I see Tess Copeland asked, you mentioned you can find this presentation on the website. Yes, it is after, because we're recording it after this, maybe within a week or so, it'll be posted and you can view it there. And then Lucille White asked, we were looking to partnering with the local university, WNY Alzheimer's Association, would they qualify as eligible partners?
I can take that if you want, Sarah. We're really stressing to have a tribal partnership. Like I just said, the more the merrier if that works for you. But I would, we're going to look at if you have a tribal partner, and then if you want to add additional partners, that's great. And if you do add additional partners, having that letter of support from those additional partners would be good too. So I would look within the tribe or tribal organization first and find another program or department that will help you meet your goals, and then have your additional partners as well.
Anyone else have any questions? And of course, if you think of something later, I'll go to my email and my phone number here. You can always call or just send an email. Well, it looks like there are no other questions. So that can, yeah, Carrie and I can stay on just for a little bit. So if you think of something, we can stay. Tess Copeland asked what my cat's name is, and it's Toulouse, for those who might be curious. Yeah, thank you all for coming. Again, we'll stay on for a little bit, but if you don't have any questions, you are free to go. And again, we are going to post this so you can come back and look. Okay, I see. Cara Bradshaw asked, can you give an example of an indirect cost that would not be supported by this funding opportunity? Carrie, can you also take that one?
Yeah, so usually indirect cost is kind of at a rate, right? So organizations have an indirect cost rate of whatever. For an example, 12%. So 12% of the budget would be towards just this category, indirect costs. What those are for folks is usually, overhead, normal operations. So the intent for these funds are that all the funds are spent on programming. It can be used for staff salaries. And since we're doing kind of a milestone model rather than a budget, so you wouldn't say line item indirect cost. You'd be budgeting, assigning amounts of funding for specific activities or groups of activities. I don't know if that helps, but without, basically, it is your responsibility to not take your budget for indirect costs. Okay, thanks.
Okay, well, thank you all for your questions again. If you have any more, you think of anything, please email or call me. Have a wonderful day. I'm going to conclude the webinar. Thank you.